Dr. Jonas Apostol.
Hi guys, so I'm back again after a long hiatus. It's been like a month because I went to Germany to study. It's been a good experience, of course, for my growth in my profession, and I was also been able to explore. And yeah, it's a good experience. But apart from that, it's really the knowledge, the systematic, evidence-based knowledge that would be implemented in my own practice. Also, we have this big project, and that is our new dental clinic. It's actually located also here in Makati, but it's a big space, and I'm so excited. Our team sobrang excited for this big project. You know, it's not just about space, but it's really that experience that we will be giving to all our patients. So watch out. This is a case of a very young beauty queen. Okay, she's 20-year-old. She's been a model, doing some social media stuff. She's also an influencer, a Binibining Pilipinas 2022 contender. And her main concern would be the smile, the teeth. How can I enhance it? How can I improve it to make her face look much more enhanced, and the smile that would really give her that signature, wonderful, brighter smile, but in a very natural way. Okay? At first glance, there is no problem because what you can see here is like a very healthy teeth, youthful. Makikita mo, it looks white naman, that there's no any like issues like black cavities or something that's really bothersome. But what we do in the clinic, and what I do especially, is dentofacial dentistry through ceramics or veneers to be able to enhance the totality of the face. With this kind of case, of course, she's young. That's number one. We have to consider the age of the patient, okay? Because it's very important not to be more aggressive with the preparation, because we don't want to mess up with the natural, healthy enamel. And we always want to save healthy enamel, okay? Because we want to prolong the health of the teeth, and every tissues of the teeth are very important, especially if it's healthy. With this kind of case, why would we want to put in some veneers to be able to enhance the face? I mean, we have to check the pros and cons. We have to make sure that we are doing more of the advantages rather than disadvantages. Okay, so we really have to analyze the case to its core, not just the beauty, but also we have to consider the health, the functionality, and the longevity of the treatment that we will be doing, because she's into beauty queen. So beauty queen needs to have, you know, a very beautiful set of teeth, because that's the selling point of, you know, of being beautiful queen or something. You have to have the confidence whenever they smile. So my job is to provide that for her. So we have to dig deeper with this kind of case. We have to be very systematic. So I asked the patient, I asked Ciacia, with the type of concerns, or what's the things that bother her with their smile. It looks beautiful, it looks healthy. So what are the concerns? So she told me that her teeth is a bit off midline. And number two, it's kind of small in relation to the face. And that's really it. It looks really small. So when I see the case, I see more to that. I see the distribution. I see a collapsed premolar. I also see symmetry and a little bit of thickness bulk problem na medyo a little bit pasok. And I want to create that smile that would really follow the curvature of the lower lip. So that's my goal for her. And also, whenever she smiles, it should look natural, that it should be unnoticeable na naka-veneers. Si Ciacia, that's my goal for her. She wore braces for a few years ago, and she's not happy with the result because veneers can do what braces can't do. Not all cases can be achieved or addressed by veneers. Not all cases can be addressed by braces alone. So there are specialty in dentistry that requires collaboration. Okay, we have surgery, we have orthodontics, we have cosmetic dentistry, and we have allied medical professionals who would help us achieve the result that we really want. So, with her case, she's not satisfied with the orthodontic treatment because it's not about the alignment only, but also the sizes of the teeth, the morphology of the teeth, and as well as the color. So that's what we are going to address with the treatment that I will going to do. We have the presence of gaps here, especially on the lower arch, the lower teeth, and it's pretty obvious. And also the color of the teeth, not that yellowish but not that white, so she wants to brighten it a little bit. So when the patient opens her mouth at rest, you can see that there is an obvious discrepancy on the lower arch, that the teeth are not symmetrical, the morphology of the teeth are a bit off because of the spaces, and also sizes problem, issues, and also the size of the upper teeth are really small, and we have to make sure that it would pop that central incisors a little bit more so that it will give her a more appealing smile, and a smile that would really enhance not just the teeth but also the lips. So since the case is very, very unusual because of the age, I'm not really a fan of doing veneers in a very young patient and has healthy sets of teeth, because I always look at the health of the teeth, functionality, longevity, and also beauty. I just don't want to do it because of beauty. But we have a lot of techniques. Because of the innovation in dentistry, we can be able to create a non-invasive to minimally invasive type of restoration, like veneers, that would enhance the smile and influence the face. So in this case, it is very, very important to create a smile design directly to the patient's face, because I want to be more predictable, especially with the thickness of the material that I'm going to use, and also the depth of the possible preparation, because in preparation we have to make sure that we create something for the margin so that it will not cause any trouble in the future, because it could be a source of a stain if we don't have any margin on that particular area. Okay, so I added volume, thickness, changed the morphology and anatomy of the teeth using composite directly to the patient's mouth, so that I can be able to carefully sculpt the design that I want for her. That would be an advantage for her. With this case kasi, it's a bit collapsed on the premolar, so I added more there just to make sure that we have that symmetry. And also, I added a little bit of length, as you can see. I want to create a more symmetrical but not too long because she has a dolichocephalic type of face, which is a bit long. So we don't want to create a long teeth also. It's more of like wider smile that would create a very subtle change that would influence the totality of the face para hindi siya magmukhang super long. So at least, we can even out the distribution, especially whenever the patient smiles. So that's one thing that we are focused on, the distribution and also the symmetry, and most especially dapat it should be in harmony with the face.
1 week later.
After a week, we have agreed to the design, and since it is a non-invasive or minimally invasive procedure, the teeth preparation was done under no anesthesia. It's just the usual burr, the usual high speed. So it's actually minimally invasive because I scratched a little bit just for that beautiful margin. Okay, that is very, 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 very important. And I did not scratch almost on some parts of the teeth because I want to make sure it's almost no scratch or scratch-free type of veneers. For this type of veneer, I chose zirconium oxide or zirconia veneers. For the whole preparation, it took us 10 days, and it's very minimally invasive, as you can see with the preparation, with the thickness of about 0.3 to 0.5 of a millimeter, super thin, and at the same time it's super durable. And sometimes the lab works would always depends on the case. For some it will take longer, for some shorter, but usually it will take 10 days to 14 days. But yeah, it really depends on the case. Before we will cement the ceramics or the veneers, we need to do try-in. Try-in is a must so that we can be able to see the distribution of everything. Because sometimes there will be a bit of a changes, especially with the final. Like we add more characterization, we add more translucency to the ceramics, we add more lines, we add more a little bit of stain just to look natural and mimic the natural sets of teeth. And sometimes it requires modification. That's why it is a must to do a try-in. We don't go straight cement. So that the patient could be able to see also the final outcome before we will agree to cement it permanently. So after the try-in, patient agreed to the design and I agreed also. So we did the final cementation easily, no problem. It took us an hour for everything from try-in to final cementation. So after the final cementation, I asked the patient to come back, of course. Follow-up is very important so that we can be able to check all the excess cements, remove all those, and also we took an impression for the night guard. And night guard is essential because once you have veneers, it will really create something in there because your mind will actually send the signal to your brain that there is something new to the oral cavity. So sometimes, even if you don't grind, baka there's a possibility that you will grind. That's why you have to protect it by using night guard. So that's very important. In taking care of the veneers, it's like as if your natural teeth. You can brush it, floss it, mouthwash. It's all the same. It's very natural looking. I added a lot of lines here. It looks natural, it looks whiter, it looks brighter, it looks symmetrical, and it's unnoticeable that she's wearing veneers. As you can see, there's a big change. She's glowing. The distribution of the teeth are much better. It looks natural. It looks like a real beauty queen here with that kind of smile, with that kind of teeth. It's truly a statement for her. So we were able to enhance the interdental gaps here. It looks pretty amazing. So as what I've mentioned earlier with the type of face that she has, it's dolichocephalic and medyo palong, but because of the smile distribution, it looks a bit not too long. It's not that obvious now because we were able to distribute it from the most distal extent of the teeth. So we did another follow-up after 2 months because she has a competition going on. So we have to make sure that everything should be on point with the smile. So as you can see, after 2 months, it's pretty amazing. Sobrang nag-iba. It looks natural. So beauty should come from within. Okay, you have to feel it. You have to own it. It should be from inside out. And it can be seen through your smile, through your eyes. So there is an inner beauty queen in every individual. Sometimes we just don't realize because we have that fear of smiling. We are conscious about our teeth and we're not confident. But that's why I'm here. I'm here to help you unleash that beauty queen inside. And that's the apostolified smile, and that's the apostolified look. Thank you.